So snakebite envenoming, mortality and disability. The majority of deaths from snakebite envenoming is caused by systemic neurotoxic and hematotoxic, cardiotoxic, myotoxic, and nephrotoxic venom effects. But the majority of disabilities, such as amputation or loss or limitation of function of an extremity, is caused by local cytotoxic venom effects with subsequent infection. And these are two examples. The one on the left is a scar contracture after a cobra bite. This is a man, 57 years old. He came to our ER department with a Malayan pit viper bite, severe bleeding. The next day I asked him from where is the scar, and he told me that he had a cobra bite when he was 9 years old, probably a huge necrosis with a scar contraction. With proper treatment, I think you can avoid these kind of severe disability. And on the left side, that was a visitor of the ICU department in Savannakhet in southern Laos. And I saw her and asked her, what about this scar? She had a Malayan pit viper bite 3 years ago with a infection of the foot, and that was a scar. And now even with this scar, she had a disability while walking. So what are risk factors that trigger infection after snake bite? It's a cytotoxic activity of snake venom. It's the extent and severity of local envenoming, the bacterial flora of the snake mouse, pre-existing diseases, socioeconomic and nutritional status of the snakebite victim. We don't have to forget 90% of snakebite victims in Laos, but also elsewhere, are poor people, and they are usually also have severe, sometimes severe malnutrition. So these are examples of the cytotoxic activity of a Malayan pit viper venom, Callocelasma rhodostoma. You see the wide variety. On the left side, you see a young woman, 17 years old, with a bite on the D2 on the right side. She just has swelling of the right foot, no blistering, no skin necrosis, the skin is intact. In the middle, you see a patient, a man, 50 years old, with severe local envenoming of a Malayan pit viper with blistering. And you can imagine here you have to be careful that can be infected either from the bacteria from the mouth of the snake or from outside. And on the left side, you see a woman, 40 years old, with a severe necrosis. It was a Malayan pit viper bite 2 weeks ago. She developed this huge skin necrosis, septic disease also, and she went home on the second day, and I think she died at home. These are examples for cytotoxic activity of green pit viper venom, Trimeresurus species in Laos. On the left side, you see a woman, 50 years old, with swelling, and you see the bleeding under the skin, the hemorrhagic activity of the venom, but no blister and no necrosis. On the right side, you see on top also only swelling, where it was a bite on the index finger on the right side. And down here, that was an unlucky young woman, 24 years old, who go to pee in the forest, and she didn't see the green pit viper on the ground and was bitten into the buttock. Also there, skin is intact, but the hemorrhagic activity of the venom caused a huge area of bleeding under the skin. And this in the middle, I got this photo just 2 weeks ago. That is a green pit viper bite from the mountainous area in Laos, Saisomboon province, which is 150 kilometers north of the capital in the mountains, 1,000 meters high. This is rare. I really rarely see these kind of blister in a green pit viper bite, but it happens sometimes, but it's rare. These are pictures of the cytotoxic activity of cobra venom. We saw in the case report a similar picture. So these are in the middle. This is a blue discoloration which starts after the bite and maybe a peak on day 2. And then some people, they develop blister like on the right side and on the left side. And these areas are necrotic, and at the end, the whole skin and also the subcutaneous tissue has to be removed. And these are sometimes huge wounds, which is a challenge for the surgeon. These are examples for non-venomous snake bites and crate bites. On the left here, that is a crate bite. Crate venom doesn't do any cytotoxic effects. You don't see anything locally, maybe a little bit of erythema, red skin, but that's all. So no swelling, no pain also. That's the reason also the patient, sometimes they don't go to the ER because they have no pain. Say, okay, no problem. And here in the middle, that is a keelback bite, a non-venomous bite. It's just a scratch, no swelling. And on the right side, that is a patient actually from Vietnam. He got bitten by a python. And you see these are sharp teeth. They can inflict severe wounds, but usually you don't see swelling, but they may get superficially infected. This is a study from Hong Kong, one of the rare studies about bacterial flora in the snake mouse. And you can see in Naja atra, the Chinese cobra, there are 100 pathological bacteria found in 32 specimens of Naja atra. In the green pit viper, there were only 4 bacteria found in 7, but only 7 specimens. And in non-venomous snakes, they found 46 pathological bacteria in 53 specimens of non-venomous snakes. So it seems that the mouse of Naja atra is, there are much more pathological bacteria inside. And now risk factors affecting the snakebite victim for infection, that is a diabetes, that is thalassemia, that is taking immunosuppressive drugs, that is malnutrition, that is older age, peripheral vascular disease, renal failure, obesity, also maybe alcohol abuse. All these you have to consider when a patient with a snakebite is coming. Do they have a high risk of infection? So here that is the risk for bacterial infection for the medical important snakes in Lao PDR, which also counts for most of the Southeast Asian region. The Malayan pit viper bite with a local cytotoxic active venom has high risk for infection. Sepsis, deep soft tissue infection, and osteomyelitis can occur after a Malayan pit viper bite. The green pit viper bite has a low risk for infection, none or maybe a little bit of soft tissue infection, but it's a very low risk. I never saw severe deep soft tissue infection after a green pit viper bite. Cobra bites, whether it's monocled cobra, Indo-Chinese cobra, or Chinese cobra, has a high risk of infection. Sepsis may occur, soft tissue infection, and necrotizing fasciitis. That means this is usually a fast developing disease where people with a high fatality rate. And also the king cobra is the same in this group. And the Malayan crate, banded crate, many banded crate, and all the other crates, low risk or very low risk, none infection. And non-venomous snakes is the same. Is very low risk, maybe localized skin infections, but nothing else. Bacteria causing snake bites. There are not much studies about this, but there's one recent study from Taiwan, Naja atra bite. They found mainly Morganella morganii and Enterococcus faecalis. So these two bacteria are found in the mouth of cobras often. And even I found it interesting, there's a study from South Africa, also on the African continent, in Naja mozambica. Also there they found Morganella morganii and Enterococcus faecalis after a bite of Naja mozambica, often in wounds of these bites. And also in all the other studies from Vietnam, and then there's another study from Taiwan where they also found Bacteroides fragilis, an anaerobic bacteria. So you also have to be prepared for anaerobic bacteria. So it's gram-negative rods, it's gram-positive cocci, and it's anaerobic bacteria. So you have to cover the whole range of bacteria infection. This is an example of a young woman, young girl, 13 years old, Malayan pit viper bite with development of a severe deep soft tissue infection. This infection didn't develop in the hospital, but she was discharged with a picture on the left side, with you see necrotic areas on the foot and on the lower leg. And then she went home for traditional treatment. And then she came back after 3 months with a picture like this, day 90. Severe local infection. There was fistula here with pus coming out, and she lost one toe here, and it was a fixed equine foot. So a terrible result. which is also a part of the pillar number 3 of the WHO, that is strengthening health system. That has something to do with inadequate treatment and the patient go home, even although on request, but it's usually also because of financial constraints. This is a young boy, 10 years old. He came with a malign pit viper bite to the hospital. He was bleeding already after six hours after the bite. He got 3 vials of antivenom. And then the mother decided to go home because there was no more money to pay for the hospital treatment. And he came back after 4 weeks, and I saw him when he had these wounds, this wound in the lower leg. And that was a severe, deep, soft tissue infection, and the surgeon has to open it quite big and take out the necrotic tissue and the pus, and it took another 3 weeks to heal. And this can be avoided if treatment starts early after the bite. Soft tissue, deep soft tissue infection often occur after malign pit viper, but I would not say often, but maybe in 5% of the cases occur in malign pit viper bites. But I never saw these pictures after green pit viper bites. They don't develop these kind of infection, or very rare. So this is a man, 50 years old. He came back after 8 weeks with a chronic wound on the toe. He didn't come to the hospital after a malign pit viper bite. He didn't obviously had a severe bleeding disorder at home. Maybe he had a coagulation disorder, but no bleeding. But after 8 weeks, he came with a chronic wound on the back of the left big toe. And the radiography shows the destruction of the phalanx, proximal and distal phalanx. That is an osteomyelitis in this area. This is an example of a cobra bite. You see on the left side, that is day 5, a necrotic area with blistering, and then step by step, the necrotic material was removed, and the wound healed only day 100. So it's a long-term treatment. And in this case, we didn't do skin graft because that is difficult in Laos to do. So we just let the wound heal. And important is for these patients to do physiotherapy. If you don't do physiotherapy for them, that they keep the movement, then they lose the mobility, and then they have a disability. But this young guy, 32 years old, did it, and he came regular to our department to check the wound, and he go to the primary health care center, and so he managed that the disability was minimal. This is another case of a cobra bite, 47-year-old man, cutaneous and subcutaneous necrosis with infection. This man went home also on day 4 or day 5, and go for traditional treatment in the village, and the result is disastrous, terrible. This is a young man, 18 years old. He was bitten by a cobra, probably Naja siamensis in Savannah Cat province in Lao PDR. He developed a small area of necrotic necrosis on his lower leg. And 2 weeks after, he came with high fever and leukocytosis. So he developed a severe bacterial infection. So we had to remove the necrotic tissue and give him IV antibiotics. And he survived. And he had only a small wound left, and probably only a small scar. So what is a recommended first-line broad spectrum antibiotics? Ideas is amoxicillin clavulanic acid, but depends what you have. That is what we have in Laos. We have amoxicillin clavulanic acid plus ciprofloxacin. I would give both together. Alternative, amoxicillin clavulanic acid plus third generation cephalosporin. And if you have the possibility and get the microbiology result, which is already difficult in a country like Laos, where there's only maybe in the whole country 2 labs which are able to do proper microbiology examination, then you get a microbiology result with resistant testing, and you can adapt your therapy. Prophylactic antibiotic treatment, always discussed. I think it's not indicated. But of course, in cases where you see already severe infection after 4 hours, like in our case, report before my presentation, then you start early, of course. But you always can give you can take care of the systemic envenoming first, and then you can decide to give antibiotics or not. And in green pit viper bites, usually it's never necessary. But for Malayan pit viper and cobra bites with severe local cytotoxic reaction, I would always go for antibiotic treatment very fast. Thank you very much.